Hello friends, I am Dr. Ankit Goyal, DBMCI. Today we are going to discuss the psychiatry questions of the recent AIIMS November 2018. So, let us come to the first question. The question is, an individual with a known psychiatric disorder on treatment and is not a minor can choose to decide the caretaker and course of treatment according to the new Mental Health Care Act. So this is known as, so the right answer is option A, that is Advance Directive. So let us discuss about the recent Mental Health Care Act. So the answer is A, that is Advance Directive. Now, so there is a new amendment in the Mental Health Act. Now this act is known as the Mental Health Care Act 2017. Now this act came into force on 29th May 2018 and it replaces the old Mental Health Act 1987. So this replaces this old act. Now let us discuss the important things in this new MHCA 2017. So one of the important changes is in the chapter 3, with the introduction of Advance Directive. Now what is this Advance Directive? It states that every person who is not a minor shall have the right to make an Advance Directive which will specify either all of these or any of these, which includes the way the person wishes to be cared and treated for the mental illness. He can also specify the way the person does not wish to be cared or treated for the mental illness. The person can also specify the order of precedence he wants to appoint someone as his nominative representative. Again, a very important thing. So we'll discuss about the nominative representative. So this is discussed in chapter 4. So chapter 4 talks about nominative representative. Now this states that every person who is again not a minor has the right to appoint his nominative representative. This nominative representative takes the decision regarding treatment and other such things if the person does not have capacity to take these decisions for him. So the order of precedence of a nominative representative let us discuss about this order. This again can be important MCQ. So the order of precedence is, first, the individual appointed in the Advance Directive as the nominative representative. So if a person has appointed someone as nominative representative in the Advance Directive, he will be the NR or the nominative representative. If no such thing is there, then a relative can be a nominative representative, or a caregiver can be a nominative representative. If that is also not there, then a suitable person appointed by the concerned board may be the nominative representative, or if that is also not the case, then the board can appoint the director of Department of Social Welfare as the nominative representative, or anyone designated by him as the nominative representative. Any designated person. So these are important things about the advance directive and nominative representative according to the new Mental Health Care Act. Now, few other important things are the, for example, in chapter 12, various changes regarding the admission, treatment and discharge. Now, few important sections that may be remembered are section 86, which gives guidelines about the independent admission and treatment. This was previously known as voluntary admission in the Mental Health Act 1987, which is now termed as independent admission. Section 87 deals with admission of the minor. Now, Section 89 deals with admission and treatment of person with mental illness with high support needs. This is also known as supported admission. And section 89 deals with supported admission up to 30 days. Generally, supported admission is done of those we need to test the capacity, and if capacity is impaired, the person may be admitted as a supported admission. Then section 90 deals with supported admission beyond 30 days. So again, important to remember, up to 30 days and beyond 30 days. Then there are few important points which are added in the new Mental Health Care Act, which is regarding the prohibition of certain procedures. So let us discuss briefly, which is done in section 95, various prohibited procedures. Now, first of the prohibited procedure is the ECT without muscle relaxants and anesthesia. That is, direct ECT is prohibited and only modified ECT is now advised. Second, ECTs for minors, that is again prohibited, but then it can be used after taking permission with the concerned board. Then sterilization of men or women, when such sterilization is done and for the intention, with the intention of treating mental illness. When such procedure is done with this intention, then that is prohibited. Then also important prohibited procedure is the chaining is prohibited in any form or manner. So this is again prohibited. Also, section 115 deals about decriminalization of suicide. That is, it states that whoever commits suicide shall be presumed to be under pressure until and unless proved otherwise, and hence shall not be punished or tried under the IPC 309 section. So this is again a very important change in the new laws in the regarding the mental health in India. Now let us discuss the next question. Now the question states, under the POXO Act, aggravated sexual, in fact it is the aggravated penetrative sexual assault includes all of the following except if done by a police officer, by threatening, gang rape, or under grounds of communal and sectarial violence. So the correct answer is option B, that is threatening. Now let us discuss about the act and the various criteria in the aggravated penetrative sexual assault. Now, so the answer is B, that is threatening. Now POXO is the protection, it is the Protection of Children from Sexual Offences Act 2012. That is the Protection of Children from Sexual Offences Act 2012. Now this act is for offences of sexual assault, sexual harassment, and pornography. So it is to protect children from these offences. Now, now what are the various criteria of the aggravated aggravated penetrative sexual assault? So now penetrative sexual assault, so in aggravated penetrative sexual assault it is even more serious. So when do we consider it as aggravated penetrative sexual assault? When there are list of a number of things which are given, so we'll discuss briefly about all these. So when done by a police officer during the duty in the police station or any other station house he is posted or otherwise. So when done by a police officer. Similarly, if done by a member of armed forces or the security forces in the area where the person is deployed or under his command or in the duty or otherwise. So member of the armed forces or security forces. Then third, if being done by a public servant. Then fourth, whoever being on the management or staff of a jail or remand house or a protection home or any other custody place. Any other custody place or protection place. If person does that, again it is aggravated penetrative sexual assault. Then if done by management or staff of hospital, it can be government or private, and the crime is committed in the hospital. If there is gang penetrative sexual assault, then again it is regarded as aggravated penetrative sexual assault. Then using deadly weapons or fires or corrosives or any other heated substances used, then again it is aggravated PSA. Then if it causes grievous hurt or bodily harm or even injury to the sexual organs, then again it is aggravated penetrative sexual assault. Now, if the penetrative sexual assault physically incapacitates the child or causes mental illness to the child, or if the child or the female becomes pregnant or becomes infected by HIV or other life-threatening infection which is life-threatening, then other are if the child is physically or mentally disabled, then if it is more than once or repeatedly done, then if the age of the child is less than 12 years, or if it is done by a relative, guardian, or in foster care, or in a domestic relationship. These are again aggravated penetrative sexual assault now. Or if done in a position of trust, then if the person knows that the child is pregnant and it is done, then if there is an attempt to murder the child, then if it is done in course of communal or sectarian violence, which is one of the options in the question, if the offender is previously committed or convicted of act of this law or any other sexual law, then again it is aggravated penetrative sexual assault. Also, if the child is made to strip and parade naked in public. So these are all the important 19 points which are added in the aggravated penetrative sexual assault in the POCSO Act. So the answer was threatening. Now let us discuss the next question. Now, so which is not included in the MH gap now. So the correct answer to this is option D, that is screening of the family members. So now let us discuss about the MH gap and the various components of it. Now, so the answer is D, that is screening of the family members. Now, MH gap or the mental health gap action program. Now, It was started by the WHO, World Health Organization. The aim is to scale up services for mental, neurological and substance use disorders, that is also known as MNS, for countries, especially the low and the middle income countries. So the purpose of this program is to provide care, spread awareness, psychosocial assistance, building communication, and giving medications to the patient with these disorders. Now, let us discuss briefly about the few of the principles of this program. Few of the principles include universal health coverage, then human rights, again one of the options, then evidence based practice, important, then life course approach, a multi-sectorial approach, that is involvement of the various government and non-government sectors. So a multi-sectorial approach, then also empowerment of the people, that is empowerment of people with the mental, neurological and substance use disorder. So these are the important principles of the MHCAP. So the correct answer is screening of the family members. Now let us discuss the next question. Now, lithium use in pregnancy leads to which of the effects on baby? So the correct answer is the CVS, that is cardiovascular defects. Now let us discuss it in briefly about the effects of lithium. Now lithium is FDA pregnancy category D drug, that is there is evidence of human fetal risk, but it can be given if benefits are more than the risk. Now, important teratogenic effect of lithium is what is known as Epstein anomaly. Important. This is a cardiovascular septal defect. Now, it is basically the apical displacement of the septal and posterior portions of the tricuspid valve, which leads to atrialization of the right ventricle. Now, this risk is around 1 to 2 per 1000 and around 10 to 20 folds more than the risk seen in general population. But even though there is a teratogenic effect, it is said that lithium is preferable to various other drugs, mood stabilizers like mood stabilizer or even anti-epileptic, Valproate and Carbamazepine. So it is preferred in pregnancy, even there is a risk of Epstein anomaly. If to be used amongst these, then lithium is preferred. So the correct answer is cardiovascular septal defect. Now let us discuss the next question. Now, if carbamazepine is added to valproate, which of the following side effects will increase? Thrombocytopenia, hepatotoxicity, hyperammonemia and pancreatitis. Now this is the question which we got from the recall from the students. Now this is a bit tricky as two of the options may be correct. So let us discuss in detail. So the correct answer, if this is the question that side effect increases, so the correct answer would be hyperammonemia. So let us discuss what is the trickiness in this question or how we can answer this question. So now let us discuss first about valproate. Now let us discuss about the serious side effects of valproate. Now the first important serious side effect is hepatotoxicity. Now this is a rare, idiosyncratic side effect, and the risk increases if used with phenobarbital, if used in age less than 2 years, or if used in mental retardation. So the risk increases of hepatotoxicity. Now second important serious side effect is pancreatitis, which is again a rare side effect, and if it occurs, it mostly occurs within the first 6 months of use. Then the third serious side effect is hyperammonemia. Now it is again rare, and but in the reference in the standard guidebooks, that is standard books Kaplan and Sadok, comprehensive textbook of psychiatry, it makes a very clear statement that hyperammonemia is more common in combination with carbamazepine. It is the statement which is made in a very standard textbook of psychiatry. So, and it presents with coarse tremors, and treatment is L-carnitine. Then it is also associated with side effects with urea cycle disorders, and in fact it is contraindicated in a person with a urea cycle disorder, that is valproate is contraindicated. Then fifth, it is teratogenic. It can cause neural tube defects in around 1 to 4% cases. Then it can cause somnolence can cause somnolence in elderly and may also cause thrombocytopenia. Now, these are the important few serious side effects by valproate. So now let us consider and let us remember while going to carbamazepine about hyperammonemia. Although it is rare, but it states, the book states that it is more common in combination with carbamazepine. And also hepatotoxicity, although rare, is a serious side effect of valproate. Now let us discuss about carbamazepine. Now, carbamazepine, again let us discuss some serious side effects of carbamazepine. Now, first is the blood dyscrasias. Now it can cause aplastic anemia, agranulocytosis. Hence it is contraindicated in drugs which also cause the same, like clozapine. Important. Then second serious side effect is hepatitis. It may benignly increase the enzymes, but it can again lead to serious hepatitis. Then third is the dermatological effects. Now it can cause in around 10 to 15%, it can cause a benign maculopapular rash, but it can also lead to serious lesions like the Stevens-Johnson syndrome or the toxic epidermal necrolysis or exfoliative dermatitis or even erythema multiforme. So it can lead to even serious dermatological side effects, and one should be careful regarding the same. Then it has certain renal effects. It can cause diabetes insipidus. Then it has also teratogenic effects. Now it has teratogenic effects. It can lead to various conditions like cleft palate, fingernail hypoplasia, microcephaly, and neural tube defects. Now, as we know, as we just discussed, again here, hepatitis is one of the serious side effects of both valproate and carbamazepine. So, if the question is a common or a more common side effect with these drugs, it is hepatitis or hepatotoxic or hepatotoxicity. But if the question says that which of the side effect is more common when a combination is used, so as the textbook or as the standard book says, so the answer would be hyperammonemia. So hyperammonemia will be more common in the combination. So then the correct answer would be hyperammonemia. So this is the trick in this question. So it will depend on what is the exact wording of the question, but we need to be careful regarding the same. So let us discuss about the next question. Now, a patient presents with habits of urinating in public and doesn't have any feelings of guilt or remorse for the same. Which of the cerebral lobe would be involved in this question? So the correct answer here would be the frontal lobe. So let us discuss about this. Basically it is depicting a disinhibitory behavior. So let us discuss about the answer. So it is the correct answer is frontal lobe. Now frontal lobe is the largest lobe. Now it mediates behavior. Now frontal lobe disorders are disorders of cognition, mood, motivation, behavioral control, or personality changes. These all may be seen in the frontal lobe disorder. Let us specifically discuss about the prefrontal syndromes. The prefrontal cortex is divided into 3 parts and each of the lesion when affected has different presentation. So let us discuss a bit about them. So the first is the orbitofrontal cortex. So it is orbitofrontal syndrome. When lesion of orbitofrontal occurs, there is disinhibition, poor social judgment, there is inappropriate social comments, there may be sexual preoccupation and sexual aggression, there may be utilization behavior may be seen. For example, the person picks the things kept in front of him and start using them, or there may be imitation behavior may be seen, and there may be certain mood symptoms may be seen like depression, hypomania, or even mania may be seen. So important about these is especially the disinhibition, poor social judgment, inappropriate comments. These are important features seen in the orbitofrontal syndrome. Then the second is the dorsolateral prefrontal syndrome, also known as the frontal convexity syndrome. Now it is associated with the executive functions. So there is problems in the executive functioning. There may be impairment in the strategy making, there may be impairment in the retrieval deficit. So these are the important things seen in this syndrome. Also there may be poor abstraction, there may be poor mental control. These things may be seen. And the third is the medial frontal syndrome. Now it is characteristically associated with apathy. There may be reduced interest, there may be poor social interaction, there may be poor motivation, there may be reduced activity levels. So this is seen in the medial frontal syndromes. So this was about the frontal lobe and the prefrontal syndromes associated. Thank you.